Hi everybody, my name is Kate Mihevc Edwards. I'm a running medicine PT and I work with runners of all backgrounds, from middle school and high school all the way to the elites and master runners. My goal is to change how we treat athletes and particularly runners. So today I'm going to take you through this presentation and we're going to talk about how to treat runners better and how it is important to talk about biomechanics and run gait analysis and glute strength, but that's only a small part of the picture when it comes to actually treating running athletes and what running medicine is. So this is just a slide that essentially says, I love running, and it talks about all the different things I do in the running world. So I own a cash-based running practice called Precision Performance. It's a running clinic in Atlanta, Georgia, and we work with the Atlanta Track Club Elite. So I go to training camp with the team, we build out their strength training programs, we treat them when they're injured, we work with injury prevention, and from that, we actually built a multidisciplinary team to work with these athletes. And through working with that multidisciplinary team and seeing how our athletes went from pretty injured and overtrained to performing better, to feeling better, to not being injured as much because they worked with this multidisciplinary team, I created the RunSource App, which I'll talk to you guys about a little bit. I do research, write books, and I have a couple of running podcasts, More Than Miles, and one that's coming out in about a month called Interdisciplinary Case Miles, which will actually be a running medicine PT, myself, MD, and a dietitian, and we're going to break down cases. So anyway, this slide says, I love running. So if you have ever treated runners or have read running research, you have probably seen this statistic, and it is up to 80% of runners get injured every single year. And this is despite changes in shoe technology, despite changes in medicine, and anything that we can think of that's related to running. So all of the shoes, technology, and medicine is not changed over the last 40 years, which is crazy to think about. So because of this, we have to think about what's missing. Why is this still happening? And we're doing all of these things. We're looking at shoes and strength and biomechanics, but what are we missing? So I want to ask you, have you had this runner that's come into the clinic that keeps getting injured even though they think that they're doing every single thing right? Most of us have had this runner or we've heard about this runner. And what we know from research is that running injuries are multifactorial. So what this means is that there are so many different things that come into play when it comes to running injuries. And oftentimes as PTs, we cannot address all of the pieces, and we're not supposed to. We need to address the obvious things like biomechanics, run gait, strength and mobility, and running shoes. But then there are all these other factors like nutrition and sleep and stress and hormones that we really can talk about, but it's not necessarily our place to address. And so what I've found with working through this multidisciplinary team is, yes, I can have this great treatment plan, but the best treatment plans are actually those that are created with a multidisciplinary team so that we can each address the things that we're best at to help these athletes move from injured to running without pain, or maybe even preventing injury altogether. And so I really want us to start thinking or rethinking about what running care looks like and why PT alone isn't enough. And so there are a lot of common gaps that we see when it comes to running care in my clinic, and also just as, working through this multidisciplinary team. So one of the gaps that we see a lot is that PTs and providers are often treating hamstring pain with eccentrics, blood flow restriction training, which is awesome, and mobility. But the missing pieces are that we're not watching them run. Maybe we're not looking at their lumbar spine or their pelvis or their ankle complex. So we have to look at things a little bit more of that kind of wider lens. Other things is thinking about managing things like Achilles tendinopathy. We might be addressing, again, with eccentrics or mobility, but we're not looking at training load and overtraining and habits and life stress. Stress is stress no matter what it is, mental, emotional, or physical. And so if we have somebody that has a great looking training plan and they're increasing their mileage by 10 or 15% every week, but they're injured, we might have to start asking questions about what other stresses in their life. Have they changed their job? Did they have a big exam at school? Did they just have a baby? Are they under financial stress? So we have to start looking at that bigger picture as well. Another thing is rehabbing stress fractures or bone stress injuries. Are we looking at low energy availability? Are we looking at relative energy deficiency in sport? Are we looking at nutrition and menstrual health? Those are all really, really important. And then the last thing I want to say is one huge gap that I see in running care is that clinicians don't ask the patient why they run or why they push through an injury, why they can't stop. And this is a really big part of it because that mental health component of running injury is huge. A lot of runners actually have a very strong athletic identity, which means that they can't disassociate themselves from their running self, and they can become very stressed and anxious and even depressed if they aren't able to do what they love. And so we really need to understand this, and working with a sports psych can be really, really helpful for this. So basically what I just said was that we can't practice this alone. So we need to take and do our part, which is the functional movement, the gait, the strength, the mobility, the education, the counseling. But then we need to also work with sports dietitians to think about energy availability, race nutrition, energy balance, and medical providers to look at imaging, blood work, menstrual health, different things like fracture risk or hormones. We need to help work with mental health providers to work on perfectionism, stress, anxiety, burnout, and even giving our athletes like mental rest strategies. And then if they have a coach, we need to talk with that coach about programming, race timing, communication, and just overall load. And so all of these things are really important when it comes to running athletes. And like I said, I work on this multidisciplinary team, but we're actually interdisciplinary, and the difference is that we actually build programs out together on a regular basis, not work in parallel, but work together. And so this is the team that I work with, and I've learned a lot with. And the thing is that a lot of times we don't have access to a team like this. And so I'm going to take you quickly through a case study, a bone stress injury case study, and show you what it looks like to work in an interdisciplinary team and how we manage something like this, so you have an idea of how this could work, right? And so this case study is for a 22-year-old collegiate female athlete, and she presents with persistent shin pain, increasing fatigue, and an irregular period. And so if we look at this case study, we're going to first look at what is the PT's role in this. So we're going to break it down by roles so you can kind of see the benefit of working with this multidisciplinary or interdisciplinary team. And so for us, first we're just going to identify symptoms that might be suggestive of a bone stress injury. So point tenderness, pain with weight bearing, pain might improve with rest, jumping, those types of things. And for some of you, you may get this person after they've been diagnosed with a bone stress injury, or they might be coming into your clinic direct access. We have a lot of direct access patients in Georgia in my clinic setting. So then we need to interview the patient, talk about medical history, talk about life changes in their training. Have they increased rapidly? Like, is there a training error happening? We're going to screen for low energy availability, or REDS, if we are the first point of contact. If it's a physician or a sports dietitian, they may have already screened for that. We're going to evaluate the kinetic chain, look at everything from how their arms swing, what's happening at their head and neck, what their posture looks like, what's happening from a hip flexion extension perspective, what's happening at the foot and the ankle. We may implement relative rest strategies or cross-training if that's necessary, if it is appropriate at the time. We will also be looking at strength and mobility programs, looking at run gait analysis and retraining when it is appropriate. We will also look at all of the different things that we need to in terms of like mobility and strength and how that weaves into that programming. And then of course we're going to be collaborating with all of these other providers. And then if we look at the sports dietitian's role, again, depending on who sees this patient first, they might screen for low energy availability and REDS. They might discuss the menstrual cycle and hormones, or the MD might be doing this, or as a PT, you might bring this up and then refer them. They're going to be looking at their fueling strategy and seeing, what's their protein timing, their carbohydrates, are they getting enough? Bone stress injuries are linked to low carbohydrate intake. What is the timing? What is their calcium and vitamin D and total energy intake? They're going to be monitoring their nutrition, bone remodeling, and performance. They're going to be discussing supplements if that's something that they need. And again, they're going to be collaborating. When we look at the running medicine physician's role, so some of you might work with running medicine physicians, but there aren't a lot of them out there. So this might be a sports med doc, this might be an orthopedic, but it's somebody that you can really talk to and collaborate with, right? So they'll be ordering their MRI, confirming if they have a bone stress injury and what grade that is. They're going to help counsel the patient on loading and return to run and work with the PT on that. So that's a collaboration. They're going to be doing blood work, looking at vitamin D and ferritin, estradiol, thyroid function, and they're going to be doing this probably with a sports dietitian if we're lucky. They're going to evaluate menstrual dysfunction and hormonal impact if they know about this. Running medicine physicians usually do. If the physician that you're working with doesn't do all of this, maybe that's where the RunSource app will come in, or looking for a running medicine MD in your area could be really helpful. They might discuss contraceptives and then determine like what the clearance is in terms of timeline for this bone stress injury. And again, collaborate with the PT and the rest of the team about return to run. And then the sports psychology. So sports psychologists, there are never enough of these in my opinion. I work with sports psychologists all the time. They're really good at helping with stress management, athletic identity, like I talked about before. A lot of athletes can't have a really hard time when they aren't able to run. They don't know what to do. So this is a really great resource for them. They'll talk about mental rest and anxiety, pressure to perform and goal setting, visualization, journaling, meditation, all these kind of strategies to help them along. Sleep hygiene is really, really important. And this could be a topic, that you talk about, the sports dietitian talks about, the MD talks about, or the sports psychologist. But as a team, you would decide together. And then how to communicate their needs. So athletes often don't know how to ask for what they need. So part of the thing that I do as a clinician and as PT is I make sure that my goals are being made in collaboration with my athlete and making sure that they agree to those goals. And then I'm going to ask them, what do they need to get through? So some athletes need a very specific plan, some don't. Typically my higher level athletes need really specific plans, and we might build those out. But the sports psychologist is a really good person to collaborate with and talk with when it comes to these difficulties. And then the coach. So this is kind of the last piece of the puzzle, not including the athlete, but the coach, if they have one. So the coach is going to be monitoring the athlete, communicating with them regularly. As PTs, we often do that too, but they're really a good bridge between us and the athlete and other parts of our team. They have their eyes on the athlete. They can communicate concerns and red flags. They'll adjust mileage appropriately if you're having that talk with them and you guys understand one another. And then they're going to keep the athlete engaged, having them go to practice, making sure that they're still spending time with the team. So this is what we do. That's all the roles that are on our interdisciplinary team. And when that works well, this is kind of what happens. Low energy availability is discovered and addressed with proper fueling strategies from the sports dietitian. The sports psychologist will give the athlete strategies to cope around goal setting, decreasing their exercise, modifying what their expectations are, and giving them tools like, meditation or journaling or mental rest to work with. The PT, we will develop a strength training and mobility program, a return to run program, look at their running gait, maybe do run gait analysis and then retraining if necessary. The MD, they're going to monitor their hormonal levels, look at the menstrual cycle, bone healing on imaging, and kind of see where they are and help guide what that load management looks like. And then the coach is going to monitor and collaborate their training load and cross-training and communicating with the team. So all of this kind of happens in a really great way when you have a team like that. Of course, the biggest thing is most PTs don't have access to this. So you guys might be thinking, like, what is she talking about? And how am I actually ever going to treat a runner if I don't have access to this? Well, that's where RunSource comes in, the running app that I created. And I created it because of the problem that as PTs, we don't have access to this. And as athletes, it can become very, very expensive to have multiple appointments. You might not have providers in your area that can actually address all of these issues. And so RunSource has over 45 running experts across medicine and performance, and all came together sharing our knowledge to make what few know accessible to all. So this is a really cool resource for both patients and clinicians alike. We can learn from other running medicine experts and professionals, and then our patients can have access to the support that they need about fueling, about bone stress injury, about mental health. All of these things are on that app. It's all in an educational platform. And so the one thing I want to say is that RunSource is not supposed to replace us as PTs. It's supposed to be an extension of care beyond the clinic. So yes, there are a lot of PT-related things on there, but what I find and what the research shows is that you can say something to your client and they might only hear 30% of what you're saying. And so you might say something and then they have the backup on the app of the same topic saying the same things. And this app also helps to support these runners more holistically across running medicine. You don't have the ability to collaborate with a full in-house team. That's okay, because now you have these people that are kind of supporting you and giving the information that you really want your athletes to have. And then again, we're no longer asking our athletes to spend hundreds of dollars more on appointments. A lot of these people are out of network or not accessible, and it takes a lot of time to go to appointments, so they have it kind of at their fingertips. The other cool thing is clients can use their HSA dollars to get RunSource via TrueMed. The app is really personalized, so there's personalized injury recovery plans. So every week it gives you about 5 different videos from different experts talking about nutrition or sleep, or for our postpartum athletes, different things about the pelvic floor, or whatever it is that we feel like is really important for that injury or injury prevention. Everything is evidence-based and from multidisciplinary experts. There's classes and recipes and meditations. And then our V2, our version 2, is coming out within the month. It's August now, so by the end of August 2025, it should be out, and we're going to be giving push notifications to help detect injury risk, looking at HRV, fatigue, stress, underfueling, with integrations with Apple and Strava and Google. And then the user interface, so how it looks, is going to be updated. It's going to be a lot better. And we even have some AI agents that are built using research and clinical reasoning, and we'll say, I don't know, if someone asks a question, instead of trying to just give them an answer, and the experience will be much more personalized. And there's all these questions that are asked on Google and ChatGPT about running, and these questions will be answered by your experts in the videos, and with the agents only pulling from our expert information, which is really, really cool. So what this is about is improved runner care. So we want to truly make an impact and decrease that 80% of runners are injured every year by actually looking at providing multidisciplinary care. And we really need to recognize that our athletes, they do need more than PT. PT is amazing, but we can't do it alone. So we're going to address sleep and nutrition and stress and biomechanics and strength and mobility and shoes and mental health. And we can do that by having this RunSource app available to our athletes and to ourselves. So it really can be a tool for all of us. And there is everything. So there's so much information. And if you have any questions, please feel free to reach out to me at kate@fastbananas.com. You can go to my website. You can go to the Fast Bananas website, which is the RunSource website, or you can follow on Instagram and at Kate Mihevc Edwards or at FB RunSource. And then, of course, you can download the app at either the Apple Store or Google Play. So I hope this is helpful, and I hope you start to think about runner care from a different perspective. And as PTs, we have so much to offer, and we can also help by collaborating with others. Okay, thanks.